Okay, so which pathway is evaluated by which pathway is evaluated by monitoring PT? So it is extrinsic pathway. Which pathway is evaluated by monitoring APTT? So this is intrinsic pathway. And how it is defined? The PT measure the time necessary to generate fibrin after activation of factor 7. APTT is the activated thromboplastin. So it is the time necessary to generate fibrin from initiation of the intrinsic pathway. Okay. What are the factors involved in intrinsic pathway? So intrinsic pathway involves factor 12, factor 11, factor 9, factor 8, platelet membrane phospholipids, and calcium ions. Calcium ions itself is factor 4. What measure to be done in HIV positive patients? So if a patient has HIV seroconversion, arrange appropriate outpatient care at specialty infectious disease clinic. Monitor the patient CD4 cell count. Observe the patient for adverse effects of anti-HIV treatment. Heart, because these are very toxic drugs. So you have to check the patient, monitor the patient for heart. Monitor for and treat possible opportunistic infection. So what will you do? Treat opportunistic infection, monitor CD4 count, and check for heart therapy complications, because some causes acute pancreatitis, some causes the vitamins deficiencies. So you have to check for heart deficiencies, complication monitoring of the heart therapy, and arrange appropriate outpatient care at a specialty infectious disease clinic. How do you manage surgery in a hemophilia B patient? So you have to do measurement of APTT first, patient counseling. You have to counsel the patient beforehand that there can be bleeding. Long-acting factor 9 products have been proved effective for surgical hemostasis, with nearly all patients requiring only a single pre-operative dose and infrequent post-operative doses. Fibrin glue, fibrin adhesive products can be used to maintain hemostasis. So usually in hemophilia, there is a problem in factor 9, so you have to give them factor 9 products. Usually one dose is required preoperatively and no dose repetition is required postoperatively. How will you counsel the patient's family? So get an annual comprehensive checkup at a hemophilia treatment center. Get vaccinated. Hepatitis B virus C or preventable. Treat any bleeds early and adequately. Exercise and maintain a healthy weight to protect the joints. Exercise and maintain a healthy weight to protect the joints. Get tested regularly for an inhibitor. Okay, so these are all about the family counseling. So what will you tell the counseling, the patient family, that you should all have a comprehensive annual hemophilia treatment center checkup, get vaccination, treat any bleed early as soon as possible, exercise to have a proper weight to protect joints because there will be hemarthrosis, gets tested regularly for inhibitors. So this is all about a hemophilia station.